If you did miss anything, we're going to do it again at 6 o'clock this evening Eastern Time. Um, so you're welcome to start back with that. Let me go ahead and introduce Jeff, and then we'll get started. Um, Jeff is from Capstone Health, who is our healthcare partner. I'm really not going to say a whole lot more than that because he's here, he's on camera, and he's gone through all the work to put this webinar together. So this is where I'm going to just sip more coffee and step out of the way and say, Jeff, it's on you from here on out.
All right. Thanks, Adam. Thanks, everybody, for taking the time to sit in this morning. I know there's a lot more you could be doing after a holiday weekend. So we really, really appreciate you taking the time. My name is Jeff Roberts. I'm the CEO of a national healthcare company by the name of Capstone Health Network. We are partners with NWIDA, and thrilled that we've been able to go ahead and have this seminar put together. We have a very special program that we think will help you grow your business and solve some major issues that smaller employers, especially in the wireless and other industries, seem to be facing. So we're going to try to do this a little bit differently. Adam is going to attempt to run the slideshow, so bear with us if we're a little bit off here. But the plan is to give you a lot of information over the next 15 to 20 minutes. And then I'm not sure if we'll have time this morning for questions, but I would encourage you to ask as many questions. Reach out to me. There'll be no pressure whatsoever. We're here to help. But the webinar is how to quickly and affordably attract and hire new employees, which is a big issue in today's economy, to reduce employee turnover, which has been an historic issue for retail. And also, we're going to offer, thanks to NWIDA, 1 month of health and dental free for your choice of your full-time, your part-time, or even your 1099 employees. So we can go to the next slide. Okay, briefly, we're going to introduce ourselves. We'll explain how our program, which is called Capstone Care, Health and Dental, it's an employee benefit, can support wireless shops. We'll talk about the special benefits that are made available to NWIDA members and those that are considering becoming a part of NWIDA. And we may, again, have time for a very brief Q&A. So we can go to the next slide. So again, we're a national healthcare company. I formed it with 7 physicians. We wanted to do something about the fact that in America, there are about 35 million people who don't have healthcare right now, and there are millions of small businesses who can't afford it. So our goal is to make healthcare more affordable, accessible, to make it faster and convenient for not just individuals, but for small businesses. Historically, what has happened in regards to health insurance is that a small employer realizes that there are benefits to offering health care, but when they take a look at the cost of doing so, it's just completely impractical. I mean, if someone's got 10 employees, for example, they can easily spend $5,000 or $10,000 a month for traditional health insurance. And it's just not something that most smaller companies can handle. So typically in the real world, what happens is a company says, gee, it'd be great if I can offer healthcare, but it's going to kill my margins. It just won't work, so I'm going to pass on it. But that makes it very difficult to compete against other companies. And the other option that we see a lot is that companies say, well, I guess we've got to do it because it's really hard to hire employees if we don't, especially because even some McDonald's are now paying $15 an hour. And in order to find employees, Amazon and others are paying outrageous amounts, which makes it extremely difficult for a smaller employer to compete for employees. But if you don't have employees to man the shifts, it's really hard to operate your business. So sometimes companies will bite the bullet and they will provide health care. But if they do, it's typically very high deductible health care, and it typically doesn't pay very much. because very few people, if any, actually hit their deductible limit. So the employees aren't happy because every time they go to use it, they're getting hit up with all these out-of-pocket fees. They're getting nickeled and dimed, that sort of thing. And meanwhile, the employer isn't happy because he's paying out an outrageous amount of money that he can't easily afford. And so we have a solution. I've been a small business owner most of my life. And so we worked really hard to put something together that would be A, affordable, and B, very high quality, that will solve some major issues that we're going to talk about in the next couple slides. So Adam, if you'd move us forward. Okay, so what are the benefits of offering the Capstone Care Health and Dental program? Well, it'll give you a competitive advantage over other stores that are not offering any kind of health and dental or any kind of benefit whatsoever. It'll make it considerably easier to attract and retain and hire new employees. Someone once said, wouldn't business be great if only we didn't have to deal with employees and customers? Well, in this particular case, many small companies have a revolving door of employees, and turnover is really costly. You've got to continually be advertising. You've got to spend time training, which takes time away from other selling and other kinds of activities. And so employee turnover has been a universal issue. Since COVID has gotten a little bit more under control and the country is opening up, there's been just a real challenge to find employees, and that makes it hard for companies to go ahead and do their business. So in our program, it'll make it far easier for you to hire, because if you're able to advertise that you're offering a health and dental benefit, a couple things will happen. You'll get more job applicants. You can be choosier on who you hire, so you can hire a better caliber of applicant. There'll be less turnover, because by offering a healthcare benefit, it tends to anchor an employee to a job. There'll also be less sick days as well, and employee call-offs, because a lot of times an employee really isn't ill. They have a child that isn't feeling well, and the only time they can see the doctor is 2 hours. So our program provides an affordable way, as little as $25 per month, for you to provide quality health and dental, and not only for your full-time, but if you choose, for your part-time and even your 1099 employees. By having a more stable workforce, you'll be able to go ahead and reduce recruiting and training costs, and it will improve productivity, because people aren't working when they're physically not feeling well or emotionally not doing well. So let's go to the next slide. Okay, so what is Capstone Care? Well, first of all, let me explain what it is and what it is not. Traditional health insurance is expensive for many reasons. There's the greed of the insurance companies, there's the bureaucracy of the insurance companies. But when you think about it, you're being asked to pay a lot of money for things you're not going to use. The insurance company has to factor in that some small percentage of the people they insure are going to need a heart transplant or a liver transplant or a month in a hospital stay. So they've got to bake those costs in. We're all paying for those things, even though we rarely ever, in fact, need them, only a small number of people. So what we did is we took a look, we created a program that deals with the 4 key areas of healthcare, in my opinion: physical health, mental health, the cost of prescription drugs, and dental. So here's what's in Capstone Care, and then we'll talk about the cost and the benefits in a little bit more detail. Capstone Care includes unlimited telemedicine 24 hours a day, every day of the year, with real US-based doctors who are licensed to practice medicine in the state in which your business does business. There are no doctor bills, there are no copays, and there are no deductibles. Now, telemedicine was never designed to treat everything, but it does treat the top up to 80% of the reasons that people tend to see doctors. If you think about you and your family, most of the time you didn't go because you had a broken leg or, for an expensive cancer treatment or something, God forbid. It was because you had a flu, you had a fever, you had a bad cold, Someone in your family had a skin rash, maybe you were nauseous, you had a child with pink eye, someone had an earache. I used it when I had a really bad sinus infection on a weekend. Maybe you want to ask a doctor a question or see if you can get a prescription refill. Telemedicine, which is basically remote medicine performed by real doctors, not nurses, is ideal for those kinds of things. And indeed, because of COVID, telemedicine has gotten much more popular because people have come to realize, hey, I don't have to get dressed up when I don't feel well in February where it's snowing outside. I can talk to a real doctor by phone, by device, by video chat, and they can write a prescription where it's warranted. Again, the doctors are all US based, they're board certified, everything is HIPAA compliant. They can prescribe non-narcotic meds like antibiotics. We do have back office electronic health records, and the telemedicine doctor care program is available every hour of every day. It's available in English and Spanish. So let's take a look at the next slide. We also include mental health, which is a really big issue. Most health insurance plans either don't include mental health counseling, or if they do, there's limitations, there's costs, there's deductibles, there's waiting periods. This is not unlimited as it would be for telemedicine. And by the way, the telemedicine program is not just for your employee, but it's the employee's family. Unlike very expensive health insurance, rather, we don't charge extra for family members, which can very often go ahead and double the cost of health insurance. But if you're not covering an employee's family, then they're constantly thinking about, gee, can I find a job where I can get coverage for my family and so forth. The mental health component is, I think it's 5 sessions with master's level counselors. It's ideal for real world mental stressors, depression, anxiety, stress. Someone just lost a loved one. They had a relationship breakup. They lost the job in the past. They're dealing with. All the counselors have experience with substance abuse, and the service is available in English and Spanish as well. The next part of the program, which is on the next slide, is discounts on all FDA-approved prescription drugs. Most commonly, the savings are 15 to 50%. These are at all the major name pharmacies, plus thousands and thousands of mom and pop pharmacies. We also have a direct-to-home mail order capability, and on very expensive drugs, literally, you can save 80 to 90% by getting the same Humira drug or whatever it might be from Canada or the UK rather than getting it in the United States. So we have discounts on all FDA-approved prescription drugs that's included in the program as well. And then on the next slide, very importantly, we include dental. And dental is rarely included even in very expensive health insurance plans. And this isn't just teeth cleanings. This is x-rays, extractions, orthodontia. There are 200,000 participating dentists in this particular program, and it's a very top program. It includes the Aetna Dental Network. We also have discounts. Now these obviously are not remote, as telemedicine and mental health would be, but these would be local participating dentists. We also have savings of 10 to 50% on vision care, chiropractic, and hearing as well. So it's a very, very robust program. Now, it's not considered to be full health insurance because we don't do hospital stays and in person, but it gives you the ability to advertise that you're offering a health and dental benefit, even though it's basically going to be about 1/10 of the cost of health insurance. There's still a tremendous amount of value and quality for your employees. Here's how it works. The first month, you would pay $29.95 for any or all of your employees. They could be full-time, part-time, 1099. NWIDA members get 1 month free, which is the second month. courtesy of NWIDA. And then if you choose to continue with the Capstone Care program, which virtually everybody does, then starting in month 3 and beyond, you would pay $25 per employee per month versus $27 to $30 for non-NWIDA members. So it's very, very, very affordable for a whole lot of quality. We also, because we know that you're busy, and I have a background as a small business owner, so we want to make this simple. So it's very easy to sign up. It'd probably take 15 minutes if it took that. We don't have to send someone into your office to spend time for a day interviewing employees. All we need is the employee's first and last name, their address, their email, so we can send them their membership package and their membership card. We do need their date of birth because that's how we find them in the system. But other than that, it should be very fast and easy. And then also to be protective of you, we know that you're in an industry where it happens, there is turnover. So all you'd have to do is send us an email saying, hey, John Smith is no longer with our company, and you will not be billed for them the next month. Likewise, if you add a couple new employees because you've been able to advertise that you are offering a health and dental benefit, which will make you stand out compared to all the others in your area who are looking for employees. And there's a big competitive bidding war for employees. We just did a national survey on LinkedIn, and we found that when people are hiring, one of the things that's most attractive to them are benefits. But historically, smaller companies have been able to afford benefits. But thanks to NWIDA and the partnership with Capstone Health Network, now you can. So let's keep going and take a look at a real world example. Okay, so let's say that you have, I'll use a simple number. You have 10 employees, an easy number to work with. Normally, it would be anywhere between $300 to $1,000 to sometimes it's up to $2,000 to provide traditional health insurance for a employee and their family. So with 10 employees, it could run $3,000 to $10,000 per month. Clearly, that's not something that is going to fit in most smaller companies' budgets. With our program, by the third month, you're paying $250, not per employee, but for all 10 employees. So very, very affordable. And you could go, and so if you had 5 employees, you can get all the benefits that we just spoke about for your employees. We also provide a lot of marketing materials that you can give to the employees that gives you credit for caring about your staff and your employees and their families. On one page, it bullet points all the benefits that they're going to get. It gives you credit for being the one that cared enough to provide this for them. And they don't have to know how inexpensive it was. So for 5 employees, the NWIDA price would be starting in month 3, $135. Now you can't buy traditional health insurance for one person for $135 at all. So if you don't offer health insurance currently, this is a very good alternative that's very affordable. It won't meet the ACA and that sort of thing, unfortunately. But if it did, it would be $300 to $1,000, $2,000 a month. But it does solve a bunch of other problems. It'll make it easier for you to hire. There'll be less turnover. You'll have less sick days and all the other things that we spoke about. If you do currently offer health insurance, this is a very good add-on because for a few extra dollars per month, we make a lot of the copays and the deductibles go away. So the employees will use the program more. Right now, if it's a Saturday afternoon and an employee doesn't have health insurance and they go to an urgent care, they're going to get socked with $100 to $200 bill. Likewise, if they have insurance, if they are a family member has a fever or a skin rash or something, they go to an urgent care on a weekend, they're thinking, okay, well, I've got health insurance, so at least it'll pay for it. But no, what will happen is they'll still get a bill for $100 to $200 because they haven't met their deductible. So with this program, there again, in summary, no doctor bills, no copays, no deductibles, There are no contracts. The program is month to month. You can cancel it at any time at all. And it's a very robust program for what it is for a very small amount of money. So it, again, addresses physical health through telemedicine, mental health, dental, hearing, vision, chiropractic, diabetes supplies, and a variety of other things as well, plus discounts on all FDA-approved prescription drugs. Now, I know we threw a lot at you in a short period of time. And so what I'm going to encourage everybody to do is after you have a chance to absorb this, and Adam could send you the PowerPoint, and there's a flyer that goes with this that explains the program as well. Everybody's need is completely different, and your company is different than the next company. So what I would do is I would encourage you to go ahead and reach out to me. You can send me an email at jroberts@capstonehealthnetwork.com, or my direct dial number, as you can see on the screen, is 440-729-0139. You could talk about your company. There's no waiting period. So, for example, if we talk tomorrow and you decided, hey, this is a great deal and it would really help my employees and help my business, because at the end of the day, yes, you want to help your employees. It's not just something that's a cost center to you. It'll ultimately help you grow your business. And so let's talk about it. The program could be put in place literally within about a week. And again, there are no contracts. So I want to thank you for spending time this morning. What I would suggest we do is, if this sounds interesting, please reach out to me. Let's get a conversation about your unique issues. If you decide to give this a try, the quality is very high. The dental network is Aetna. The telemedicine provider has 5 million of their own subscribers. The discount drug program comes from a company that's been around for 20 years. They're A+ rated with the Better Business Bureau. They have saved their members over $1 billion. And so I think you'll be very happy with the quality, and it will help you attract, retain your employees, cut sick days, and make you more competitive. And since you're not constantly hiring all the time, and you can more easily staff your shifts, it'll actually help you with your bottom line in terms of growing revenues. So I want to thank Adam very much for setting up and hosting the presentation this morning. And I look forward to speaking to many of you over the next couple of days to see if we can put the Capstone Care Health and Dental program in place for your business so that you can get the benefits that we just spoke about. So I want to thank everybody. I know it's right after a holiday. You probably have a lot on your plate. So I'll let you get back to it. And
Hey,
Adam, was
Jeff.
there any final?
Yeah,
Yes.
just real quick, if I'll throw it out. The chat is open. If anybody has a question, you can ask it now. As I mentioned, this presentation has been recorded. It's going to be on the NWIDA YouTube channel. If you subscribe to our daily newsletter, you'll see a link in there as well. We'll put Jeff's contact information in there. This is a tremendous benefit, not only for NWIDA members, but we've decided to open it up for all wireless shops as well. Yeah, our members get, a little bit of a bump. They save a bit more money. They get a free month, which is, always great. But if you have any questions, ask it now, and we'll just give it a second. I know Jeff has a hard stop. And if not, and if you did miss any of this and can't wait for the YouTube, then we're actually going to do this again at 6 p.m. tonight, 3 p.m. Pacific for the folks on the West Coast. And with that, Jeff, thanks very much. I appreciate you guys coming on. Everybody else, thank you. And we'll see you at 6 o'clock.
And Adam, I'll call in 10 minutes early tonight.
Sounds good. Thanks, guys.
Thanks, everybody. Take care. Thanks for your time.
Bye.